What's up, everybody? Today, we're going to be talking about some conditions and injuries that can affect the voice. Now, a couple things to keep in mind before we start this today. Number one, this is not meant to be scary. We are going to talk about the different conditions that can affect the voice, as well as ways to prevent them. So I hope that you'll view all of this information through that lens, and that you won't be afraid to go on singing and doing all the things that you love to do. You'll just maybe keep a few things in mind as you go through living your life. The first condition we'll talk about is a really common one, laryngitis. Laryngitis is just inflammation of the vocal folds. Here's a video of a laryngoscopy, which is where a doctor puts a camera just above the vocal folds. You can see where there's inflammation right in the middle of the vocal folds where they're not fully coming together. And there's actually a buildup of mucus there. If you look carefully, you can see that it's kind of just bubbling around the vocal folds. And if you remember, mucus is one of the things that increases when the body is dealing with a vocal injury. It's sort of part of the repair mechanism. So while these vocal folds aren't showing any growths or additional injuries, that swelling is going to cause hoarseness in the voice and probably extra fatigue and maybe difficulty singing or speaking. Causes of laryngitis are environmental and behavioral irritants, including allergies, drugs and alcohol, illness, acid reflux, and dehydration. Laryngitis can also, of course, be caused by vocal misuse and overuse, which we've outlined in another video. Typically, laryngitis will go away with some vocal rest or even on its own and will not lead to further injury. That is, unless a person continually overuses the voice in this condition. If the voice continues to be used strenuously in this condition, it can lead to hemorrhage, scarring, and other conditions, which we'll talk about in a moment. So the best treatment is really just vocal rest and extra hydration. It's also important to identify the cause and behaviors that are leading to laryngitis, whether that is as simple as illness, or maybe it's overuse, something in the environment, maybe dehydration, or something about your lifestyle habits that is leading to this inflammation. Now I want to talk about another condition called muscle tension dysphonia. This is one that doesn't get talked about as much as other vocal conditions, but it's a pretty important one. Muscle tension dysphonia occurs when the muscles around the larynx become so tight and overactive that the voice doesn't coordinate properly. This typically causes hoarseness and gaps in one's range, and it's often accompanied by the feeling of tightness in the throat, sometimes even pain in the neck that's sore to the touch. Because this condition is not really diagnosed based on any visual anomalies on the vocal folds, and rather it's defined primarily by its symptoms, it often goes misdiagnosed. Muscle tension dysphonia is typically the result of poor technique that results in the overactivity of the muscles around the vocal folds. That is, they're working way too hard to get the vocal folds to come together, and it is often exacerbated by stress. So it's interesting to note that one's emotional condition can actually have a significant impact on the voice. It's best treated with voice therapy that looks at one's habits when getting the vocal folds to coordinate, and of course, making adjustments to vocal technique that result in less strain on the vocal folds. If muscle tension dysphonia is left untreated, the excess tension in the musculature and also the extra pressure on the vocal folds is usually going to lead to swelling and probably to other types of injuries. One such injury is a vocal hemorrhage. A vocal hemorrhage is a rupture of one or more blood vessels on the vocal folds and can be thought of very similarly to a bruise. You can see on this image that there's been a hemorrhage on the right side here, indicated by the blood that's sort of spread out through the epithelium. And when a hemorrhage happens, a singer will typically notice that something is wrong immediately. A lot of singers describe it as if a curtain has come down on their singing voice, and there is something immediately different about the way that their vocal folds are coming together. The most common cause of a vocal hemorrhage is trauma or extreme overuse, although certain factors can make the voice more susceptible, which we've talked about in previous videos, one of which is the use of NSAIDs or non-steroidal anti-inflammatory drugs, which we talked about in the video on lifestyle factors. Other factors, of course, are smoking, alcohol use, and continuing to use the voice when it's already swollen, such as when one has laryngitis, or even on the first or second day of one's menstrual cycle when the vocal folds are naturally a little bit swollen. Nevertheless, there's almost always some sort of event that causes that rupture of the vocal folds, and typically it will be when one is actively using the voice. Now, like a bruise, the vocal folds will typically heal completely from a vocal hemorrhage if they are protected from further trauma. And in the context of the voice, this means complete voice rest. That means no speaking, no singing, no whispering, no screaming or yelling, no using the voice in any way. A doctor will typically prescribe vocal rest for several days, maybe even a week, And after that, most people will see the vocal folds come to complete restoration as if nothing ever happened. On rare occasions, surgery is sometimes necessary in order to prevent scar formation or other issues, but most of the time, vocal rest is going to be the primary treatment for resolving a vocal hemorrhage. Just like any other type of vocal injury, one will need to evaluate the causes of that injury. There is almost always some sort of event or habit that is going to lead to this issue. And if those habits are not resolved, they can lead to further problems. One of those problems is a vocal polyp. Vocal polyps are fluid-filled lesions or bumps that develop on the vocal folds, usually on one side, and they are most similar to a blister. Vocal polyps are typically going to cause hoarseness, gaps in range, difficulty singing or speaking, and sometimes biphonation, which is when one goes to produce a sound either in speaking or singing and two different pitches come out at the same time. Sometimes it can happen when you're sick and it's kind of a cool party trick, but really not ideal for the vocal folds. Vocal polyps, like many other injuries, are typically the result of trauma or overuse/misuse of the voice. And unlike some injuries, which can be the result of chronic misuse or overuse, polyps can form after a single event, such as coughing or screaming. They can also be the result of continuing to speak or sing on already swollen vocal folds for a long period of time. Polyps are also often preceded by a vocal hemorrhage, which is why if a vocal hemorrhage occurs, it's really important to, number one, go on vocal rest to prevent the injury from getting worse, and number two, to resolve the lifestyle or technique factors that resulted in the vocal hemorrhage in the first place. In the very early stages, voice rest may resolve polyps, but after they are fully formed, most of the time, polyps do require surgery in order to remove them. That being said, because polyps do occur only on the superficial layers of the vocal folds, surgeries are usually very successful. Now I want to revisit a particular type of polyp which we looked at in the smoking and vaping video called Reinke's edema, or smoker's polyps. Edema refers to a type of swelling that happens when fluid accumulates in membranes, and specifically Reinke's edema is fluid retention in the area between the outer epithelium of the vocal folds and the vocal ligaments on the inside. It results in a lower pitched speaking voice, a husky timbre most of the time, a loss of high range and falsetto production. Reinke's edema can also cause a restricted airway, as you can see here where the vocal folds have actually blocked part of the trachea, which would cause difficulty breathing. 97% of people who develop Reinke's edema are habitual smokers, and although it can be caused on some occasions by acid reflux, it is obviously much more common in smokers. In order to treat smoker's polyps, one would obviously want to eliminate the risk factors, i.e. smoking, that causes Reinke's edema in order to halt its progression. But in order to deal with the existing damage, one would need laser surgery to make an incision and then actually suck out the excess fluid that is leaked into the membranes. And then they would probably need voice therapy in order to learn to re-coordinate the vocal folds properly. Now I want to look at a vocal injury that has gotten a significant amount of attention in popular culture, specifically in the movie Pitch Perfect.
I hope you all remember the way you feel right now so you will never want to feel this way again. Chloe, your voice didn't sound Aguilarian at all. Chloe, for serious, what is wrong with you? I have nodes.
What? Oh my God. I found out this morning.
What are nodes?
Vocal nodules. The rubbing together of your vocal cords at above average rates without proper lubrication. They sit on your windpipe and they crush your dreams.
So yes, nodules are an injury that should be taken seriously, but if you know about them, they don't necessarily have to crush your dreams. Vocal nodules, or nodes as they're often called, are callus-like lesions that are located on the edge of the vocal folds. So they typically occur in pairs, usually close to the middle of the vocal folds. So you can see one here and one here on the right side. And these lesions prevent the vocal folds from coming together properly. Now, unfortunately, nodules disproportionately affect women. And while there are cases of men who get nodes, it's much more common for women to get them, and part of the reason for that is that they largely affect the high range. And of course, women, especially sopranos, are more likely to be singing in that range. Nodules also affect the ability for one to sing quietly. So an individual who has nodes is usually going to be found singing largely in one dynamic, usually pretty loud. They're going to lose access to their higher range, and they're going to have trouble getting those really light, quick onsets in their sound. Nodules are also typically going to cause gaps and hoarseness/breathiness in the affected range. Now, that's important because that means that the breathiness is typically going to occur in the higher register, but not necessarily in the lower register. Sometimes individuals with nodes will develop husky or hoarse voices in their lower register, but not always. And this is what makes it different from muscle tension dysphonia. If you remember, individuals with muscle tension dysphonia are typically going to get husky or hoarse voices throughout their range, but individuals with nodes may only get breathiness or hoarseness in their upper range. This is often why individuals with lower voices don't necessarily get diagnosed even when they have nodes, because they're not singing in that upper range where that hoarseness is exposed. Whereas a polyp can be caused from a sudden event, nodules are typically the result of chronic misuse or overuse of the voice. That is, they don't happen overnight. Many people are afraid that they're going to sing badly once or scream once and get nodules. While there might be other injuries that can result from those activities, nodes are typically the result of chronic habits that occur over a longer period of time. Now, fortunately, most cases of nodules can be resolved without surgery. Typically, instructions from a doctor will be voice rest and voice therapy. Voice rest might range from anywhere from a few days to a week or maybe a few weeks at a time. On occasions, surgery is necessary, but usually the outcome of that is positive, especially with today's technology that utilizes lasers for as much precision as possible. Now, as I said at the beginning of the video, none of this is meant to be scary. All of these problems are preventable, and most of them are even curable without surgery. So if you are experiencing vocal trouble in any way, don't panic. The first and primary thing is to examine your speaking, singing, and life habits to see if any of them are contributing to vocal challenges you might be having. That being said, even singers with flawless technique sometimes run into issues. As we've talked so much about, we live in our instruments, and sometimes there are environmental factors that are out of our control. Additionally, people who use their voices professionally sometimes come under intense demands. Broadway singers sing 8 times a week. Classical singers have to sing sometimes 2 or 3 hour shows, and there are other types of demands on teachers, presenters, voice actors, and other people who use their voice for their livelihoods. Sometimes it's not even a matter of you doing anything wrong, it's just that it's too much. And so when you notice that your voice is getting tired and it's just come under a lot of stress, it's important to just rest. So when you're taking advantage of vocal rest, remember you need to stop singing, stop speaking, stop whispering, certainly don't yell or scream, and just take it easy until you notice that your voice is starting to return and that discomfort is leaving. You'll also want to remember to hydrate. Remember that dehydrated vocal folds are more susceptible to vocal injury, and so that is going to be an important line of defense for both prevention and recovery. And finally, if the problem continues to persist for weeks or months, you'll want to go to an ear, nose, and throat specialist who is a laryngologist. This person is going to take a scope with a strobe light on the end of it. They're going to put it down your nose, take a look at your vocal folds, and see what's going on. These doctors are then going to give you additional recommendations for the type of voice therapy, voice rest, or other interventions that may be necessary in order to get your voice back into working order. Now, if you're looking at a career in professional voice use, a lot of ENTs will actually recommend that you get what's called a baseline scope. That is, you go to an ENT when your voice is actually fully healthy, so that if you ever have an injury, they have something to compare it to. Everybody's vocal folds look slightly different. Some people have anomalies on them that actually don't affect their voice at all, but it's good to know that those are there before there's an injury. So while we've looked at a number of different conditions today that can help you be more aware and maybe help you keep in mind some precautions that you can take in your life, you don't want to go around living your life in fear. Singers are a lot like athletes. Athletes need to train and also learn how to protect their bodies in order to play their sport to the best of their ability and have the most fun doing it with the lowest risk of injury. And singing is a lot like that. We train and we learn to sing with good technique. We also learn about vocal health in order to protect our bodies so that we can do it with the lowest risk of injury. At the end of the day, the good rule is just pay attention to your body. If it hurts, if it feels uncomfortable, take a break. And after you've taken a break and maybe reevaluated some of your habits, just continue to sing, make music, and have fun. Until next time, see you later.